consumers, just like they got trained on how to use, version 1.0 digital front door to access flights, hotels, buy stuff, they're going to get trained on how to use an LLM to search for, purchase, and complete transactions. And so that's the next big, I think, frontier for laggards in the system to figure out real quick.
Try to fix the current system or reimagine something new. Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show. This is a mission, y'all. As builders and operators, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. First up, we have the Flava of the week about the movement of consumer health. What's driving the greatest momentum that we've ever seen in this space? And how are we, you and I, influencing the industry to grow its adoption? I'll talk about that. Then join the celebration of reaching 500 episodes. Zain and I point to insights that have stood out as consumer-centric healthcare has evolved and what's coming next, from how perceptions shifted over the years to how preventive health has moved from the margins to the middle, what role the health tech ecosystem is playing, and what it all means for everyday people engaging in their health. For the 500th time, I'm Jared Johnson. Let's get it.
Flava of the week.
The road to our first 500 episodes, as well as our next 500, is all about movement. I want to point out two meanings to that word. The first is a social movement, a group of people who share the same beliefs, ideas, or aims, and is a collective attempt to further a common interest or secure a common goal through collective action outside the sphere of established institutions. Consumer-centric health is a movement. At times, it's felt practically revolutionary to urge industry leaders to go a different direction, one in which the needs and expectations of those whom they serve, namely patients, consumers, and family members, are considered or even put in the center of what gets built, marketed, and adopted. We've learned that we can't do that at the expense of clinicians or institutions, but rather we have to approach change equally with them, hand in hand. If you're in our audience today, you're likely a member of this movement, or at the very least, you're interested in what we have to say. Another word for movement is momentum, and that describes what we're seeing in the marketplace in real time. Things that weren't possible years, months, or even weeks ago, such as ChatGPT, Claude, Perplexity, Gemini, and Copilot answering hundreds of millions of health-related queries every day. Hundreds of companies actively building cross-functional demos in real time through CMS's health tech ecosystem Slack channels. The highest first quarter funding for digital health since peak pandemic, and dozens, if not hundreds, of direct-to-consumer digital health, primary care, and virtual care options now being available with cash pay. So listen, I was at lunch the other day with a couple of colleagues, and one who was familiar with this show asked me, to what end? Meaning, what will success look like, and what do we hope to accomplish? What change do we hope to see as a result of building out the healthcare app community? I answered, the change we're working to bring about is to grow adoption of consumer health products and services. As we do that, we'll influence significantly more people to proactively engage in their health. And that's what this is all about. Speaking with founders, builders, and operators on this show and hearing directly from them about how they're building and marketing their services has fundamentally changed my perspective. When I tell people this show's taken on a life of its own, it's become a trusted source of primary information that stands on its own, in contrast to half-baked hot takes or divisive one-dimensional echo chambers. No one else has published more content on consumer health than us, and no one else has made more of an effort to bring the industry together rather than pitting it against itself. And that's why this movement is only growing. So we'll continue to bring the right people and ideas together to grow adoption of consumer health, and we'll continue to invite you to be a part of it by coming to the table and joining us. I promise you, the table's big enough. There's room for you. Let's renew our commitment to the consumer-centered health movement by coming to the table and learning from one another as we work to influence the adoption of products and services that help us engage more proactively in our health. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week.
All right, this is episode 500. Let's get into the flow. Zain, I just don't even know if I had thought a few years ago that we would ever get to this point, but we are here. Number 500. Welcome and congrats.
Thank you. 500. I can't I wonder, do you remember off the top of your head what show number did I join? I know it was on the heels of the pandemic. It's got to be, was it 200 something, 300?
I can tell you. I can tell you because for some strange reason I keep track. 43, Zane.
Wow, that's great. I know it wasn't on all the interviews since then, but that's, wow, like 300 episodes have gone by ish since my tenure at the Healthcare Wrap. And I still don't have a salary. How can that be possible, Jared?
Is that possible? Let's talk to healthcare. Who do we need to talk to to get that going? Let's figure that out.
You need us. Hey, I would, as long as we can get sponsored enough to get swag. You know, I've been asking for a Healthcare Wrap hat or vest or something. Maybe this year we can just finally do it and put our own money together and get some stuff.
Swag is going to happen.
Yes.
It will happen this year.
Yes. Manifest.
There's that. That's just part of the celebratory mood I'm in, I guess.
Yes.
You know, sure. Let's do swag. Let's do other stuff. Let's celebrate. This is pretty wild. I think what our goal today is to just not only look back, but to see what signals it's given us for the future, because I think a couple of things are pretty clear from the beginning. Again, that was 2021 when you came on board. The show's been going since 2018. I think a good starting point for us today is just the fact of what that looked like, because everything has changed since those early days. When I look back, first off, I just think about where the industry was, and when we were first recording and we were talking about things like, are retail models even possible? We weren't even calling them retail models. It was before major billion-dollar plus investments were happening from retailers, from CVS and Walgreens and Walmart and Amazon and everyone else. And it was before that. And it was hard to remember that far back. But we were talking about questions like, is consumer-centered healthcare even possible? We were starting to use those words. And I feel like the reactions have changed a lot since then, even to the term like consumer-centered healthcare. What do you remember about those early days?
Yeah, I remember in those days where even the term consumer-centered still gave a lot of leaders a lot of pause. Folks, were really aligned around the term patient. Thinking of your patient as a consumer within a traditional healthcare institution was still very novel and not accepted by a whole lot of people. It gave, a lot of clinicians, I think, some heartburn, which makes a lot of sense. So I remember that piece. I remember too, I having, and frankly, I think what made the podcast successful, like just doing a lot of like basic education, like what are we talking about when we talk about consumer centricity in health? What do we really mean when we talk about digital health? Avia, who I used to work for, which maybe we can talk about that update at some point, was doing a lot of work at the time in educating and teaching the industry about this term, the digital front door, and what that really means. And so, back then was the early days. And I think the key to that was just a lot of education. And it seems like, and I'd be curious what you think, we've now kind of moved through this season where finally people understood that some of the things we were talking about made a lot of sense, and more investment flowed. There's more and more evidence that how we were thinking about the health space was the right way. And now I don't think there's any question where some of what we're talking about in a lot of ways feels like a commodity, or the basics of the things we talk about feel like yesterday's news, because of course we understand that this is the way to go. But curious how you've seen it go from at least the initial evolution to today.
Yeah, I remember talking about two paths early on. One was the health system centric approach to health, and the other was the consumer driven approach to health of I'm going to figure things out on my own. And yeah, even a few years ago, there weren't as many options on either of those sides. And we definitely weren't talking about things like longevity. We were barely starting to approach the topic of prevention, because the conventional wisdom had been, hey, if this is from a health system, prevention doesn't pay, it doesn't get reimbursed. So it's not part of our core business. So regardless of how true that is today, it's still very true. There are on the edges of traditional care and consumer-driven care, direct-to-consumer health options. There are on the edges of those partnerships that have come up, and explorations and discoveries of options that exist. One of the frequent topics we've had here is direct primary care. So that's an example. Connected fitness is one of ours. I'm sure we'll bring that back up multiple times, right? But when I'm talking about wearables, consumer wellness devices, GLP-1s, food as medicine and nutrition, those weren't topics years ago, but those have all come about. They've all emerged as there's money in it now. There are founders in the space who are committed to getting through the funding cycles and making something available. The majority of those founders have a founder story themselves where something in the health system or their own experience or the experience for their loved ones didn't go as planned and they wanted to create something better. So I think we can come back to that, that process for founders because that's significant. That's what drives a lot of innovation in this space. So I think that evolution's happened. So kind of back to those two paths, right? I think we refer to them as path one and path two even years ago. Path one, health system centric. What can I do to engage with my provider, with a health system, with a network of hospitals and providers and specialists more than that once or twice a year when I'm getting a wellness visit or preventive visit. So between those things, there were a lot of questions that came about. There was a lot of tech infrastructure that came about, and there was a lot of business model, at least exploration. Not necessarily that code has been cracked yet. I don't think it has, but the questions are being asked differently in a lot of those areas. And so there was still a long time. And I still think you could make the case that there's a pretty big partition between the health system centric part of healthcare and me as a consumer, the things I'm figuring out on my own, because those usually are things like prevention, wellness, weight management, metabolic health, hormonal health, things that might not be profit. That let's make it clear, they're not profit centers for health systems, and so the focus is different. And yet, what we've been able to do this entire time, every single episode, as far as I'm concerned, is we've been able to learn more about the consumer point of view. We've been able to learn more about how people address their health. A lot of times we refer to it in first person. We are consumers. We're all consumers. Yeah. We're not just a health system, or healthcare leader or digital health founder. We're trying to understand how that point of view drives new business models, drives new growth and new partnerships. And I still, to this day, I think probably a year or two after COVID, I thought the conversation would be in the ethos of the industry, at least more pervasively. I'd be hearing more about the consumer point of view in how we talk about any news or announcements or trends. I think it's still underrepresented. I think the consumer point of view still is underrepresented in what we hear about healthcare, at least from industry sources. I thought there'd be 5 other shows talking about things from the same viewpoint as us by now. They're not. Not that I know of, not that I can see. So I think there's a lot of progress. And I think that just gets us to understand why some of the guests that we've had on multiple times and some of our favorites have really stood out to us. So
another thing that comes to mind that I remember we spent a lot of time talking about early on is what are the tools? What are the tools that system leaders need to think about? And so we spent some time talking about human-centered design, design thinking, and how that applies to helping you carve out a more consumer-centric focus in how you run your business or how you run your hospital, so to speak. I also remember spending some time with people like Kelly Gill, where we talked about our health systems even, or legacy, call it legacy incumbents in healthcare, even hiring the right skills for what's needed. And we more or less determined at large, no, Silicon Valley was hiring all these people. But a shift I've seen, just being an active LinkedIn user and, previously working in a consulting firm where our job is to keep tabs on health systems and everything we're doing, more and more health systems did start to hire some of those Silicon Valley titled roles, maybe not pay that level, but those titled roles. So I think about Baylor Scott White, which has a whole digital product team, Houston Methodist as well, Rush University Medical Center, which I've had the privilege of doing work firsthand. They have product owners and consumer journey owners, things like that. Again, titles that we just didn't see in the early days, nor did health systems have an affinity to understand what these roles even do. And so I guess just to summarize, they got there, but they're certainly laggards in their thinking, right? So that's encouraging to see as well.
I agree. And Kelly's one of the best. That's why we've had him on multiple times on the show. So shout out there. I think a couple of the things as we fast forward from those days to right now, are more fascinating than ever. I think the proliferation we've been doing the flavor of the week ever since the first or second week of January about all the new generative AI chatbots and platforms that now connect to your health records, or at least have the option, or rolling it out at some point. They've announced healthcare features. They're all the tools that everyone uses. ChatGPT, for health, Claude Healthcare. Now we have Perplexity Health. Now we have Amazon in the space. They started out rolling out AI specific chatbot features in their One Medical app, and now they've rolled out a lot of those features across the board to anybody. And Copilot, Gemini. I mean, they're everywhere. Fitbit under the Google umbrella. So those tools, to your point, Zane, you talk about this a lot. These tools have changed the game for that entry point. It used to be just a friction point that health systems couldn't really solve for in a lot of ways. Of I'm hurting, I want to feel better, I don't know where to start, I'm frustrated with my previous experience as a consumer with my provider, I don't know where to go, I don't know what to do first. That's a different experience now because of these tools, and the toothpaste is out of the tube. Like we're not going back.
No. There was, I saw it on LinkedIn. I'm going to misquote the numbers, but I think it was a JAMA article that took a look at like what are the prompts that the majority of people are typing into Chat GPT, and like a significant number, like more than 10%, more than 20% were healthcare related and healthcare navigation related. So if I'm in charge of the consumer experience or even top line revenue growth for a legacy health system, I would be very concerned because my channels are likely starting to be disrupted. And as we've talked about, these tools should be able to, with the right prompting, widen the aperture of potential solutions that the consumer or the user should choose versus just pick up the phone and go to a urgent care, right? And so, as I've mentioned, like even with my own health, uploaded my labs and asked ChatGPT, like, what's your opinion? And then called a few of my physician friends in addition to my own physician. And frankly, I have a better understanding of my health, and not just, I personally will not and probably will never just take the sole opinion of my internal medicine or primary care physician. So sorry if you're listening, Dr. K, but I mean, as a nerd, as a healthcare nerd, I'm just so curious to see like what someone else might say, and so I think that's the opportunity. And then as other outside of healthcare, like in retail, as agentic search and agentic e-commerce becomes more of a thing, consumers, just like they got trained on how to use, version 1.0 digital front door to access flights, hotels, buy stuff, they're going to get trained on how to use an LLM to search for, purchase, and complete transactions. And so that's the next big, I think, frontier for laggards in the system to figure out real quick.
I agree. I think it makes me dig a little deeper into what's possible in the term that, we're not the only ones to coin it, but we use it a lot, the constellation of care. We've heard the term quarterbacking your own care. At some point, you realize that no one else cares about your health as much as you do. So there's still always going to be some level, it's usually a lot, but like some level of initiative you have to take, and you just have to be self-educated, and you have to learn and start understanding your options. That's the heart of consumerism, right? At its core, having options and understanding them. Now, what drives that in the market is when you have more choices, those players start competing and improving the experience for you and making certain parts of it easier. So that was such a new concept for healthcare not that long ago. We still talk about it from the medical standpoint. The medical community will still tend to talk about it in a bit of a negative tone because a lot of reasons. I think one of them is just it can feel like it just destroys a little bit of the sanctity that they consider that there is around the provider patient relationship. I don't discredit that. I like to factor that in. I think over the years, I think some of the things that I probably doubled down on in the past, I've learned, and I've heard from other perspectives of like why something is so challenging. I used to just come in here and like a bull in a china shop and be like, why can't we improve this? Why can't we get better at this as an industry? Hey, let's do this. And I think I've learned from other sides of the industry, I feel like, and had a better perspective of where things are going. And I think another side of that perspective has come from dedicating myself, kind of like yourself. I mean, you've tried a lot of things yourselves. I mean, as new AI platforms have come around, as new tools have been announced, we like trying them out. I also like trying out a lot of wearables and medical like consumer devices. And, I'm just giving a shout out to a few of them already, but ones we've been able to try out ourselves, all the way from Reperio
Yep.
Health's home health screening, where we both did it on our own and then compared notes. But it was because like we were willing to try it. There's the Oura Ring with the Dexcom glucose monitor that I tried. I'm just like, I just want to see how this works. The whole thought of trying things yourselves, I think both of us have shared our findings as we've gone along the way. I've learned, from the Withings body scan. I've learned from the Alive Core, like it was a heart monitor, heart rhythm monitor, which is crazy. You put your fingers on for a few seconds, it gives you your heart rate, gives you basically an EKG. The technology is just another component, the consumer tech that's now available. I have sitting here on my desk right here a kit from Bastion Health, so I'm going to be doing some blood tests. Just it's amazing. Things like that are just part of the equation that weren't there. And if we only look from the health system point of view, and if we only say, hey, whatever my provider prescribes me, we're not only missing out, but we're not catching up on things that are available now that are being released like every day. There's new devices and there's new services that are out there. So I guess that crystallizes one of our missions here, which is to be one of those sources for not just you as a healthcare leader or a builder, an operator, or a founder yourself, but as a consumer yourself. We're here to help you see what might be right for you to try out yourself. It's been a cool one of the coolest kind of like unexpected results of doing the show all these years is to recognize all that's out there. And anytime I bring up any of the things that I've been able to try with loved ones who, I don't know if any of them are in healthcare. I think I'm the only one in my family in healthcare, my immediate family anyway. And I bring up any of these new solutions, they're not familiar with them. So they want to know more about them. And they want to know like, where's a trusted source I can learn more about it. So that's the business that we're in right now, like is being that trusted source, making people aware of more options. So again, yeah, we're kind of back to like what's the point of having consumerism in healthcare?
We're top of the marketing funnel for people, helping raise awareness about what they're doing. I think some of my reflections, maybe they're self-serving, where I think we really hit it off. It's really in our yearly predictions episodes with the team, I think. I don't think we've ever been like just like flat out wrong, but I think we've been directionally correct for some time now. And so, the big prediction we've stuck with just about every year, like the future of digital health will be connected fitness. That has proven to be like true, and continues. I thought like more value-based models would have taken root by now. And so, I mean, it's still happening, but that feels like a little bit of a landing flat. And then the other one that I think we're right on is some of our predictions around, just traditional hospital systems kind of coming under the gun, calling out their value. Why are they technically not for profits? Why don't they pay tax? Like, are they really helping consumers get healthier? I think we're continuing to see that trend a little bit, as people recognize that there's now these other tools and models that help them live better, increase their longevity, more fitness oriented, obviously, more food oriented, things like that. I think it will continue to call into question, like, what is the value of some of these more legacy models? And that's not to say like, gosh, like if you are in a car accident, you need to go to the ER. Like we need ERs, we need cancer surgeons, we need trauma surgeons, we need subspecialty super specialists, we need drug research. Right. But altogether as a value proposition, this idea, which you talked about, is like thinking that they're the only ones that can help you is just certainly an old school mentality, in my opinion.
Absolutely. Yeah. I think you're right. I think we've been directionally correct for a long time. We've been able to see some of these things. And as they've gone through waves, like all the investments in retail health in the main drugstore, chains that we're all familiar with, and see a lot of those investments fall flat, it was easy to say, look, see, consumers didn't want that. And I think there have always been a lot of like kind of collateral or parallel stories or insights from a lot of journeys on the retail side about like what worked, what didn't. And I think it's important to not just point to perceived failures in the marketplace as, hey, something didn't get solved by the next quarterly earnings report. And so that's not what consumers want in their healthcare. if there's one thing we've learned, especially from founders in the space, those founders who are able to take their idea, create a product or service. Dr. Wendy Sue Swanson was just talking about this a few weeks ago. There's a difference in just sitting there, and it's really easy as a clinician, from her point of view, to talk about what works and what doesn't, but to go through the process as a founder and be able to go through the research, get funding, create the product, get it out to people, build a brand, show people at a consumer level how something helps them. Does it make them feel better about themselves? Does it protect them against something? Does it help them, just regulate something in their body? That process has been a learning experience for her, and it was kind of like a rallying cry, it sounded like. So she's not the only one to express that. That was one of the more recent ones. And a lot of founders who we've had on, that's been just one of my favorite things to hear from. Those in leadership positions who are looking at what problems can be solved, and then building the business system underneath it so that it works. Because that's the last thing we want is for that graveyard of digital health to get bigger. The things that don't work, the failures, or at least I'll keep coming back to perceived failures. I'm not convinced a lot of things that headlines refer to as failures were ultimately like, hey, there was no good to come of this.
Yeah.
A lot of times it just means, like earnings didn't lead up to what stakeholders expected that quarter. So there's a lot of factors.
Yeah, and like what I would say is like, and it really grinds my gear when I hear hospital executives like talk about like even Amazon and how they failed with a couple of their ventures. Well, Amazon is not out of the healthcare business, and groups like Amazon, knowing a few people that work there, like they're a learning business. And so they just took what they learned and reapplied it. Like Amazon now through One Medical, Amazon, Amazon Connect, whatever, Amazon Pharmacy, Amazon Clinic, they're definitely in the telehealth space, right? But they're not gone. Yeah, maybe some of these physical sites didn't quite work, but with their acquisition of One Medical, they're right in there. And so sometimes there's like this narrative that's just not true. And then, some other retailers I'm familiar with, they've certainly taken their learnings from their first version of what they thought their healthcare strategy is and reapplying it elsewhere. And in a sense, like regrouping, right? And, I know Kroger's in the space too. And sounds like you're going to their conference in a few months or a few weeks. And so I'm sure you'll find out more, but it's not just a one and done from some of these guys. And so I think it's very foolish to, especially these companies that are extremely well funded, to think they're not going to keep cracking at this. Because in their world, you got to understand, like their investors are looking for growth. And there's only two places to grow in the US now. Once you're the size of some of these companies, that's either in education or in healthcare. Everything else has been covered. And so they're going to keep cracking at it until they prove out a model.
Would this be a good time to give a little more detail on your recent
So
news?
Can't say a whole lot because, they're super conservative, but for our listeners, some of you might know I've made allusions to it. Used to work with Avia Health Innovation for 4.5 years as a digital health advisor to hospital systems. Made a huge change and now serving as director of strategy advancement for Walmart Health and Wellness. So I am in one of those retailers, and as per usual, my participation on this podcast will just be my own opinions and never actually reflect the views of who I work for. But yeah, I'm on the retail side, which frankly is like so weird given the discussions we've had over the years. I never thought I'd actually now be in the position to lead innovation and strategy from that vantage point. And so I actually credit you, Jared. Thank you. Like I used a lot of what I've learned through this podcast and being a part of this in my interviews, and I've been 2 weeks at it and already using some of the knowledge with the team. And so doing a podcast on the side has been great professional development. So thank you. And thank you to everyone who listens and reaches out all the time. And we've met so many people and collaborators through this podcast. And so that's it.
We really have. That's awesome. And I've been congratulating you and so happy for you. And I will redirect that to all the guests we've had. It has changed not only my perspective, but my belief in what's possible in this industry. It has, that sounds cheesy, but it's true. It has changed what I think we can actually do, what progress we can make. And again, part of it does come back to hearing directly from the sources. I think in this day and age, we can't emphasize it enough. The fact of we're not necessarily just listening to people giving hot takes or using their ChatGPT written posts on LinkedIn. Don't get me started. Just don't get me started. You can point them out a million miles away, even when you get rid of the M dashes, y'all. But
so much AI slop out there.
It's just the same. But we are able to speak to the leaders in these organizations and at least consider their point of view and at least hear what their vision was. The questions we've been able to ask so many hundreds of guests over the years of what's your founder's story? What's your vision for this? Why are you trying to do this? How does it work? What's the business model underneath it? How do you keep it going? How do you make money at it without feeling like we have to stray or avoid any of those topics? Those are the things that have to get asked so we all understand. And I do think, to your point of honestly, it's one of the best things to hear ever, that anything on this show has been able to help somebody professionally to land new opportunities, to land new roles, or to see themselves differently, or to be able to speak from an area of expertise on a topic because of something they've heard here. That's one of the unexpected pleasures of doing the show.
Yeah, I feel like
Yeah.
I know like we introduce ourselves as podcasters, but what I'm realizing is really we're educators and curating insights from other people and trying to share them back. And so maybe that'll be part of a course I teach someday in my retirement.
Ooh. All right, we'll keep that door open too.
Yes.
Like one final topic or just thing to get your opinion on before we wrap up on this, because again, our goal is just to share our reflections from our time here. But we've talked about generative AI. We've talked about new AI platforms and tools. The other kind of piece that's been more under the surface that has bubbled up and made a lot of progress in the last 9 to 10 months is the health tech ecosystem and infrastructure that's in place on the health IT side. Some of it is driven by current administration of CMS and where they've put their money into the Rural Health Transformation Program, into the CMS Health Tech ecosystem, the Kill the Clipboard initiative, and the pledge that hundreds of companies and organizations have signed on to, at least outwardly. Again, we don't have to dive into like how meaningful is this, but like outwardly, there's momentum in these areas, and there's momentum in being able to take investments that haven't always existed or been available and come together and actually like change the conversation. So I'd like to think that that's a place where we continue to live on this show, is that we continue to bring that to the forefront. We don't enter this trying to be cynical. We also don't try to be Pollyanna about stuff. We just like to share the things we've heard that kind of makes sense based on our own points of view and experience being in the industry. So I think it's just worth pointing out that, there are so many opinions out there. If we can continue to be a trusted source in some of these areas, we'll keep bringing the guests that we can bring to listeners and to viewers, so that so that you're able to hear directly from the source as well. It's changed my point of view, and I'd like to hope that it's changed others as well. So just one final thing as we
put out there to our listeners, either as a hard sell / pitch, or just put it out to the gods, is having read through the Rural Transformation Program funding proposal from CMS, there's actually money and a mandate for all these states to like share best practices, like share what's been going on. Like once the plans get approved and actually start doing stuff. And, I just wonder if anyone's listening out there, like come and talk about what you're doing in rural through this program on the podcast, and we'll find a way to highlight it. I think that would make some excellent content to get very granular on. Here's the problem we tried to solve in, rural South Dakota. Here's the partners. Here's how we use the funding, and here's what we learned about it. I think there could be some wonderful content that, as we've said before, urban health systems and urban players can learn from, from the people that are in the trenches in rural and small town communities. I'm just putting that out there. If anyone's listening, call us.
We could have a whole spinoff series on that, is my belief, because again, if we can be a trusted source there as well, and we always cover a lot of ground. I'm just looking forward to continuing to share who we have on the podcast. I will say, as we continue to go, and this is still season 12, we're still talking about the marriage between healthcare and preventive care. That's likely just our theme, regardless of what campaign or what season we're in from here on out. That's the core of the show. So we have some fantastic CEOs, founders, and other leaders who are coming on in the coming weeks. Just as usual, we'll continue to add to that lineup. We love hearing who you want to hear from, and we will do our best to work there. And we also have some exciting announcements about the Healthcare Wrap universe, about how we are taking this well beyond the podcast. This will continue to just be our engine and our way to build relationships but there are some really exciting new developments there coming in the next few weeks that we're excited to share as well.
Well, and kudos to you, Jared, because I don't think people fully realize, in addition to this podcast, there's kind of like this whole constellation of people through the community that we keep in touch with. I'm on multiple LinkedIn message groups that, are always firing off every other day. And so not only have you created this podcast, but you've built a community of people that are following you through all these years. And so big kudos to you for having the vision and foresight to start a show about this topic. So thank you.
I appreciate that. And I always do look forward to the relationships that this show has built. It wouldn't be the same without it. So thanks again. Number 500 is in the books. We're looking forward to what's coming next. And, as long as there's more to rap about, we'll keep doing this. So I think we're going to be doing this for a while.
Love it. Thank you.
Thanks, Zain.